Let's discuss how to bond a zirconia crown and emax crown practically in our clinical practice. This is not a live demo of a patient, this is a dummy model demonstration. Let's discuss the zirconia first. When to bond a zirconia or lute a zirconia? If you have a sufficient mechanical retention and you have a good crown length of the abutment, you can lute the zirconia with help of a normal GIC itself. If you don't have a sufficient abutment crown height, you need to bond the zirconia. And let's discuss what are the material required for conditioning the prosthetic crown and conditioning the abutment crown. And the first thing, get a sandblasted zirconia from the lab, and you need to do the try-in procedure in the patient. After try-in, if you have a sandblasting device in your clinic, it's well and good. If you don't have, it's not a problem. And don't rely on the cheap air polisher available in the market for sandblasting. After trying to remove the salivary phosphate, we need to sandblast the crown again, or we should use the product IO Clean recommended by our mentors. And practically it's an investment. To avoid that, you can use 5% sodium hypochlorite. It's well and good. So far, I didn't feel any problem without using IO Clean. I am more comfortable with the sodium hypochlorite. It didn't affect the longevity of the crown retention. Just for the demonstration purpose, you have to place 2 to 3 drops on the bonding surface of the zirconia. You have to place the 4 to 5 drops of hypochlorite for 20 seconds and then air dry the surface. And the next thing, you have to use a primer for increasing the bonding surface of zirconia to the tooth, and this primer has 10 MDP component, which is essential. Dispense into the applicator tip and apply that on the bonding surface of zirconia and leave it around 30 seconds and air dry it. And you need to dispense a self-adhesive resin cement for bonding the zirconia or a normal resin cement. Even though having a self-adhesive resin cement or having a normal resin cement, you need to apply a bonding agent that contains 10 MDP. And I am using a self-etch bonding agent over here. It will etch the enamel surface also, and it will have 10 MDP, improves the bond durability and reduce the interface failure. You need to just coat the bonding agent over the abutment tooth, and you should not cure it, and just leave it dry for 30 seconds. This is because you are using the adhesive component of the bonding agent when you don't have a self-adhesive resin cement. And you have to dispense the adhesive cement and mix it. Then you have to place the mixed resin cement over the zirconia crown and bond the zirconia to the abutment tooth. After placing the crown, make a tack cure, remove the excess, and then followed by a complete curing of the resin cement. Let's discuss about the emax bonding demonstration. The material required for conditioning the emax bonding surface. The first thing is 5 to 10% hydrofluric acid. It is available in ultradent product. It's the bonding surface of the emax. If you don't have the hydrofluric acid, you can buy monobond etch and prime from IOCLAR. It's a single step procedure to etch the bonding surface of emax. After applying the etching, I have to leave it for 30 seconds and then wash it with the E3-way syringe. Demonstration, I am wiping it with the cotton. And the next product, you need to have a silane coupling agent, and it also available separately in ultradent brand. And you have to apply the silane coupling agent and rub it over the surface, and you have to leave it again for 1 minute, air dry it. Next step, in the abutment tooth, you need to use the self-etch bonding agent for etching the enamel, and if you have a selective etching procedure, it is well and good. You have to apply the bonding agent and never cure it again over here. Next thing, you need to take the mixed resin cement and place it over the abutment tooth surface. Do not place it over the emax crown. because it's not going to hold them, and then place exactly over them with help of adhesive applicator tip if you have. Well and good. Cure, remove the excess with the help of the gloss and cure it completely. And let's coming to the conclusion. For zirconia you need to follow APC, which is the sandblasting and using the primer, and then using the adhesive component of the resin cement. For emax you need to etch the crown with help of hydrofluric acid and apply silane coupling agent, and then bond with the help of resin cement. Like, share, subscribe Dear Madness Dentistry for updating more about dental products.